Hey, this is Dr. Tom Rogers coming to you with a weekly podcast. We're in a series where I'm talking about supplements that will help your immune system. And I'm always talking about the two things that most people come to see a doctor for. Either they're tired or they hurt, especially as you age, which I'm a member of that club. But anyway, I'm going to talk to you today about one of the most important vitamin supplements that you can ever take. It's essential, really, that I think older people, as you get older, take it. It's called CoQ10. I'm going to throw in something at the very end that works really synergistically with this vitamin supplement. But it's odd that because I remember somebody telling me back in the early 80s that they took this supplement called CoQ10. It was an athlete that said he told me it gave him tremendous amounts of energy. I thought it was nuts because I was already a doctor and I didn't know anything about CoQ10. It must not exist. So, how many years later, 40 years later, this thing, I'm putting everybody on it. I've been taking it for a few years myself, and it really does help give you a lot of energy. But anyway, CoQ10, it's a nutrient that really occurs naturally in the body. The problem is you can't get enough of it through your foods. Usually you find CoQ10 in meats and nuts and sometimes fish as well. But it's a very potent antioxidant which protect your cells from damage. And this also helps your metabolism. It's really for energy, and that's why I take it, but it also has some tremendous other qualities for it. It can decrease your blood pressure. It definitely helps heart failure. That's why I call it the heart health warrior, as coined by Jeff Thomas, a good friend of mine. So it definitely helps heart failure. I mean, if you go into the hospital with a heart attack, or you go in with congestive heart failure, which is the most common cause of readmission to hospitals, you should definitely be taking CoQ10. You can even get this in IV form. The other benefits, it helps your brain. It may slow Alzheimer's disease. It helps migraines if you take it daily. It takes a few months to start working for migraines, but it definitely helps prevent migraine headaches. And it also will help decrease sugar levels, so it helps your diabetes. And there's a lot of studies going on that it may help reduce incidence of cancer. Very good for your skin as well. A lot of people apply it directly to their skin. It's great for that, easing wrinkles, etc. For years, I've made it a mandatory vitamin for people that take statins to help them lower their cholesterol. So if you have to take a statin, you definitely need to be on CoQ10. As you know, statins can damage your liver and your muscles. So if you get that muscle ache from the statin that you may have to take, hopefully not, but you may, if you have known heart disease, you'll notice when you take CoQ10, it'll ease that muscle aches that prevent so many people from getting off their statins that may need them. It also helps your fertility. There's a lot of good evidence that it protects eggs and definitely will increase your sperm count. So it's a great fertility supplement as well. Of course, it decreases as you age, like most things. We check levels of this in my Cleveland Heart Panel. A CoQ10 level is on there. So if the folks at the Cleveland Clinic think this is important, then you should think it's important. It is very important, and you need this supplement. How does it work? It really works by helping you generate energy in all your cells. It works by making ATP, which is the source of energy transfer in all cells. You're talking about your mitochondria. So it helps your mitochondria work better with this energy transfer. It's really focused or concentrated more in the organs of your body that require the most energy. Think your heart, your lungs, your kidneys, your liver, your brain. It turns out this thing was introduced in 1983, ironically, by Life Extension. They helped find this supplement back in 1983. And in that year, it was in the form of ubiquinone. There's two forms of CoQ10. Ubiquinol, which is one I recommend, and ubiquinone. I like ubiquinol. They both work, and there's some transfer when you get when it gets in the cell between both forms. And ubiquinone was the one that was discovered first. It's been the most studied. But then in I think it was 90, maybe 96 that they found um, the form ubiquinol, which is a lot more absorbable than ubiquinone. So I usually recommend ubiquinol, and I love the life extension product because it has something called shouldnt, and that's unique to the life extension brand because of patent rights, etc. And it just makes it a lot more absorbable. So if you get the CoQ10, I suggest you get life extension. It may cost a little bit more than stuff you can get at some of the other big discount places, but I guarantee you that it's going to be more absorbed because it has this in it. It also has the date of expiration, etc. That's why I like life extension. They've been around for over 40 years, and they started out with this product. So that's definitely the one I take. It's definitely more absorbable. I mean, they've measured it. Because a lot of forms don't get into the cell. Ubiquinone, you're going to lose half of it when you swallow it. Ubiquinol, especially the life extension brand, is going to be about 90% absorbable. So that's the form that I do take. When should you take it? It is fat soluble, so take it during the day, preferably in the morning. It gives you energy, but take it with food because it's fat absorbable. I take it at lunch because I do intermittent fasting, and I don't eat until lunchtime. The dose, anywhere between 100 and 500. Some people have taken up to 1,600 milligram and done well, but usually, the average person takes 200 milligrams. That's what I take. You'll definitely feel the energy boost if you haven't taken this supplement. Who shouldn't take it? Well, you have to watch it if you're on a blood thinner like Coumadin. Because it may thin your blood just a little bit, but I've never found this to be a problem. But if you're on Coumadin, watch your protons for sure. So I really like this supplement. It really works great as an antioxidant. It helps your mitochondria produce more ATP, thereby more energy. It has a lot of good effects. Now, I'm going to throw in a little bonus here for you today. Something that works very synergistically with CoQ10. And it's something that's really the rage in nutritional circles if you get into that. And it's called PQQ. It's another quinone, kind of like CoQ10. But it's not as well known, and it probably will be, just like I told you that story about the athlete who told me about CoQ10 40 years ago. PQQ definitely helps your mitochondria as well as CoQ10. CoQ10 makes mitochondria work better, produce more ATP. PQQ actually helps your body grow more mitochondria. It's found naturally in the body. You find it more in plant foods. But again, you just can't get enough of this in your food to really help you, especially as you age. So I like PQQ. What does it do? It decreases glucose levels, makes your insulin work better. It actually increases your testosterone levels as well. And those are two areas that I focus on, preventing diabetes and also increasing your testosterone level. I do a lot of work with hormones, as you know. It works by increasing something called nerve growth factor. And it's been postulated that it really helps decrease beta amyloid plaque in your brain. Think Alzheimer's. So it's definitely, I call it the brain health warrior. I call CoQ10 the heart health warrior, to call PQQ the brain health warrior. And they really act synergistically to give you a lot more energy, help you age better, and that's what it's all about. So think about looking into taking CoQ10. That should be on your mandatory supplement list. And then think about adding PQQ to it. Very, very good together. I'm certainly going to keep taking them. There's no doubt that they work. all the medical literature supports this. So think about these two supplements. Hope this helped. I'll see you next week.